Hello, my friends. Thank you so much for joining us again right here on Kardec Radio. This is Spiritism, a closer look, and we do this every Wednesday at 7 p.m. Eastern Time. This is Luis Lima here, broadcasting from Orlando, Florida. Tonight, we are going to take a closer look at autism and spiritism. And I have a guest. I'm bringing a special guest, Dr. Sergio Thiessen. Sergio, how are you?
I'm fine, thank you, Luis. It's a pleasure to me to stay here with you and with your friends. Thank you
Well,
so
thank you
much.
very much. Yeah, thank you very much for taking the invitation and for such a challenging topic, talking about
Yeah.
autism and spiritism. I don't know, I might be wrong, but I believe autism is a term, is a concept that got really into our society. It's a broad term. Everybody has heard of it. So there's a generic idea of what it means in our society. It's so much disseminated that, people know what it is. So for us spiritists, the question is, the social concept of spiritism is not, the social concept of autism is not the same of spiritisms. What is the difference? What makes one different from the other? That would be something to discuss, right?
Luis, I am a physician and I need to study autism or autism spectrum disorder in medicine. But I recognize that we have many different ideas from the humanity, from the people, from different countries, and different specialists in medicine, including about autism. But I needed to know about that autism is a medical problem.
Mm-hmm.
The first colleague, a psychiatrist from Europe, Leo Kanner, described for the first time exactly 81 years ago, because he and his group in medical science put together 11 cases with different signs and symptoms. So Leo Kanner is the first one to describe this disorder, psychiatry disorder. And we need to recognize that we have different ideas about this, but this is a science, and we need to study autism as in medicine, in psychology, but especially in terms of neurology, pediatrics, and psychiatry. But as a spiritist too, I would like to share with you some different understanding about this very important situation in humanity, because we have 1% of all of the people around the world with autism spectrum disorder. This is very important. And we are looking some kind of exponential growing number of cases in each one of the countries around the world. So we need to care about this as doctors, as scientists, in terms of the understanding that we can know about this.
Mm-hmm.
But I have a PowerPoint, and I would like to share with you some main aspects to share with you. Maybe, for example, autism spectrum disorder, spectrum because we have different levels of suffering and different levels of intensity of the suffering in the symptoms and signs. So this is an heterogeneous set of clinical syndromes having in common the triad impairments of reciprocal social interaction, verbal and non-verbal communications with impairment too here, and repetitive and or stereotyped behaviors. This is the main aspect of each one of my patients and the patients around the world, varying on a continuum from mild to more severe forms. As we utilize in medicine grades 1, 2, and 3. The 3, they are the most severe cases. And all of my patients and the patients around the world, we need to establish, because including we can see during the medical approach and evolution, we can see benefits changing, for example, the stage of each one case. We can see during the time more severe presentation, but we can see, for example, from the first level 3 to level 2, for example. This is a good aspect that we need to do the best to offer this kind of prognosis in terms of better and less suffering cases. Let's go. The behaviors are common among all ASD individuals. What changes is the intensity of the manifestations and the severity of the involvement. A person with a mental disorder, I would like to point this with you. A person with a mental disorder is first and foremost a person and not a disorder. Do you understand the idea?
The focus, right? Don't focus
Yeah,
on the disease, focus on the person.
human beings, brothers and sisters. Thus, we come to understand that within this individual with the disorder, there is a person who desires, who feels, who understands, who hears, who smells, who likes and dislikes a soul. Do you understand this?
Yeah, absolutely. And that's great. Great.
So, my friends, autism, these difficulties can exist from birth and be obvious to everyone from the birth, or they may be more subtle and become more visible throughout the child's development. The earliest the diagnosis recognition, the better. This is always independently of the medical problem. We need to do the best and the good diagnosis as soon as possible, because from the diagnosis, we will have many aspects to offer to each one. ASD is by the DSM-5 from 2030. ASD is a general condition for a group of complex disorders of brains developed before, during, or shortly after birth. And now we have some ultrasound evaluation to detect autism during the investigation in the mother during the pregnancy, before the birth. Do you understand? These disorders are characterized by difficulty in social communication and repetitive behaviors. Let's go. Intellectual disability. So this is the one list of possibilities. Luis, do you understand? They can be associated with each one case of autism, maybe or not. intellectual disability, difficulties with motor coordination and attention, epilepsy or seizures syndromes, sleep, gastrointestinal disorders, attention deficit, hyperactivity syndrome, dyslexia or dyspraxia. And in adolescence, they may develop anxiety and depression. Such disorders are known as comorbidities. This is common in each one of the different diagnoses in medicine, but here in autism, this is very frequently. And including, we need to understand that when we have, for example, convulsive crisis, seizures, in one case, we have one more difficulty to the managing of the case. So we have 2 or 3 or 4 problems to the same child. Do you understand?
Yeah, sure, absolutely.
This is very important. This is one medical, materialistic, in terms of science and medicine point of view, because in medicine nowadays, nobody knows the true cause of this impressive syndrome, because of the number of the cases and because of the clinical presentation, frequently in the levels 2 or 3. So it is a very, we have difficulties to manage because we don't know the origin. This in a medical, scientific, common point of view.
The straight material.
Yeah, perfect. Decrease in mirror neurons, decrease in cortical mini columns, very important this point. Disorganization of the prefrontal and temporal cortex, alterations of the cerebellum and basal ganglia, hippocampal tonsils, decreased interhemispheric connectivity by the corpus callosum, increased inflammatory activity, and impairment, disorders of neuroplasticity and neurodevelopment. But this we cannot find in a resonance image exam, for example. This is pathological findings when the child died because another problem, and the parents offer the case, the brain, to analysis during the last 20 years. Do you understand? We don't need to indicate exams to the diagnosis of the autism spectrum disorder. This is a clinical presentation and a clinical diagnosis signed by neurologists, psychiatrists, or pediatricians.
Right.
Because when we firm this diagnosis, we have many consequences. So we need to have the best criteria to do this. And when we have some doubt, we wait to do in the last year, in a few months, the complete idea of each one case. Okay? Let's go. So it is worth mentioning, autism is a permanent condition. The child is born with ASD and becomes an adult with ASD. But in Spiritism, when we do some kind of approach, for example, I have many cases of complete recovery. And we are sharing in the Psychiatry International Congress this kind of results.
Very important. Very important.
Yeah, there's a hope in this matter, in this issue. Causes, the studies, this is a medical point of view. The studies are not yet conclusive, but there are several reports of organic, neurological, and biological abnormalities, as well as genetic, immunological, and perinatal factors, biochemical and neuroanatomical findings related to autism. But this is not the true causes.
No.
Do you understand?
Yeah.
Yeah. Well, this is one patient, my patient from my office, and talking with his parents, I could see this. This is Lucas. And then I invite him and the parents to stay with us in the Spirit Society to achieve the best in terms of spiritual benefits. Because in terms of this kind of medicine, spiritist, more than spiritualist medicine, spiritist, we use two main aspects to care. Maybe patients with different problems in medicine, but we are dealing now with autism spectrum disorder. But we need to offer the disobsession, the mediumistic meeting to open each one of these cases with a big and experienced team. Two kinds of team. The people around me in terms of incarnated mediums, obviously. Frequently, they are medical professionals too. But it is very important the spiritual environment, because working in this fashion during 4 decades and a half, we have so nice spiritist friends of this intention to care and to benefit the people. Spirits in the spiritual world related to the medical science in the after that, and they are together with our incarnated groups, open each one of the cases that arrive to us in the Spirit Society. And this is Lucas, a very severe level 3 autism.
We can see on the images,
Yeah. This is the first idea of the case. This is not some preventable attitudes. This is independently of the willing of the patients. This is spontaneous. So when we open the case, we find, this is a spiritual idea, we find, because of the old reincarnations, one very troubled life involved with the war, with a very extensive prejudice to many people. And we care of that victims of that war, of that conflict. And when we care of those spirits related to the mind, to the brain of the patients, they becomes free from that past occurrence or drama.
They detach from the situation,
Yeah. And then when we use the second aspect, the passes, the magnetic approach to the brain to change those differences from the neurotypical brain, we can see the benefits. We frequently need to use 1, 2, or 3 different opportunities month to month, and the passes to bring to the case a very important aspect to change the brain of the patients. Here, one photograph with the grandmother, completely different, and here with the mother, Juliana. This is photographs, but he is an autism in those days, but in a different level, completely different from the first time when this case arrived to me in my office.
Yeah.
Luca.
That's another one.
This is William. One case from Salvador, Bahia. The mother sent to me, and here we can see the crisis.
Yeah, it's really, he doesn't have control, it seems, right, on his own body. Yeah, like the other one.
Yeah, I'm trying to change the.
And I think it gets clear, at least to me, that the spiritual treatment has an impact. Here. Yeah, here we go.
Here we go. The same in the same time. Suffering. The same. This is my son in medical terms. I adopt everyone. Here, after 2 occasions of carrying the case. Here, the mother recording a completely different situation of William. The first smile that I could see, and you too now.
Yeah, it looks like he's more aware of what's going on now.
Yeah, the mother doing a video to grateful because of the result. This is priceless.
Yeah. Incredible.
The last one, one case from Rome, Italy. The mother Brazilian, the father Italian. Rome, various treatments with no improvement by WhatsApp. She sent to me parental difficulties, impending separation, mild psychic problems in his 2 brothers, very, very mild. Watched lecture in internet by me sharing about autism, and then she write to me, I'm being invaded by suicidal thoughts. Help me, please.
Wow.
Including today, my thought is either me or Rafa in this existence. Spiritist.
Incredible.
Crying, disturbed, very important disturbed, because we have sounds, but you cannot hear now. In crisis, with the father in the lunch, in the evening meal, the Italian father, in the car, going to a park completely disabled with
Yeah.
violence included.
Yeah.
And 2 weeks after the first one approach, today we will toast 2 weeks of Rafa without crisis. Thank you, Dr. Sergio. And 1 month, the same. We have already reached 2 other weeks of Rafa without a crisis. Here, completely different. In a play near the home,
Yeah.
and the mother asking to send a kiss to me. The mother,
Woohoo!
the mother and me in Padova, Italy, during a meeting to share about spirituality and medicine. And here, the smile, giving me and to us too a kiss.
Yeah. Beautiful, beautiful cases. Yeah, the spiritual treatment. It's like you said in the beginning. There's a point of view that comes from medicine, but it's not enough to do anything more productive because you're not working on the causes. So I think your work is incredible on this and very unique, by the way, because I don't know anybody else doing this much with so many cases. Of course, you presented 3 cases, but you have a million cases, and like you
Yeah,
said, 40
I would
years.
like to tell to you that um, we have cases with not so good results. This is science. We have a big spectrum of possibilities, but always in all of the cases, we try the same because many of them so nice results. So the approach is the same. Mediumistic meeting to care each one of the cases, and the magnetism trying to benefit directly to the brain.
Yeah, and I think we should do another one of these lives with not necessarily more cases because you have a million cases, but maybe talk about uh, the gap left by medicine when they approach cases like this and how spiritism fills in the gap in a little bit more explanation on that. I think it would be very
Yeah,
beneficial to all of us, myself,
this is the science.
science
This
part of
is
it.
a science. We
Yeah.
need to study, practice. We need to do many things to understand and to share. I would like to tell you, Luis, that we are visiting all of the most important congress in world psychiatry and sharing this result. Always when I send an abstract to the Congress around the world. They accept because they understand that they need some different ideas about this so important problem in mental difficulties in children and adult people too, adolescents.
Yeah,
This is
because the
a very
classical approach is not working, right? So they need something new, like you said, and that's where you come in. You got all.
yeah.
I'm not gonna say you got all the answers because spiritism, we are all still learning, but it makes a tremendous difference bringing that knowledge from spiritism into the gaps left by science.
Sure.
So, Sergio, I wanted to thank you so very much for being here with us, and you already know you're gonna come back. I don't have to tell you that, right?
Okay. Thank you so much.
Well, thanks so much. And for you following us here on Spiritism A Closer Look, we will be back here. We do this every Wednesday at 7 p.m. Eastern Time. Thank you so very much and be well.